A fundamental truism of hip and lower back pain is one of the same truisms that applies to the rest of the body. It's that what you don't use, you eventually lose. And that's especially true when it comes to ranges of motion, and especially at ball and socket joints like the shoulder and hip. Now, this is more relevant to some of my heavier athletes, some of my heavy-duty squatters, Olympic weightlifters. We tend to end up not spending a whole lot of time in what's called hip internal rotation. Think knee dropping inward. We tend to lack that mobility. We don't necessarily train into it even. However, it's very difficult to spot in your own training. A good way to check yourself with this one and to see if you do lack that internal rotation is with what's called a Z-sit position. And really, some people refer to this just as a 90-90 hip and knee. However, it's like when you compare both sides, is that you will find a huge discrepancy between sides may be the reason behind, say, your lower back pain, your hip pain, your knee pain. However, it's a good auditing procedure. So what you want to do is try to set up a 90-degree knee position in both. Think knee, the heel points toward your cheek. And now take a mental snapshot of this position. Ideally, you have an upright, easy spinal position, and ideally both cheeks sit on the ground. Take a mental snapshot here and then switch sides. Again, 90-90 hip and knee position, upright spine, both cheeks on the ground. Now ask yourself, does it feel the same on both sides? Or is there a bit of a forced position? For example, on my opposite side here, I find it a bit more difficult to sit into my hip. So now what do we do about this? One of the best mobilization tools is actually a relatively heavy kettlebell. Now this may be coming from a couple different structures in both the front and the side of the hip. Now without splitting the atom, it's like we go into TFL, glute minimus, glute medius. However, the kettlebell handle will show you exactly what's restricted. What you want to do is take this kettlebell and flip it upside down using the handle actually as a soft tissue mobilizer. So think of right where the hip crease begins is where you want to start your scan. However, prop yourself back on your opposite arm and then do a very, very slow scan from the inside of the hip crease toward the front and then even all the way out on the side. Now, if you find that a couple different zones are very tender, that's exactly where you want to target. So for example, I get one right about here. So what I'm going to do is use this kettlebell handle to apply the pressure while I use my back arm here to prop my torso up as straight as possible, thinking a straight lower back position, and then I'm going to sit this same side hip straight into the ground. Now this does provide a little bit of an uncomfortable rotation about the knee. So if you find that the inside portion of your knee is a little uncomfortable with this, you can always bring that heel in a little bit closer and still get the rotation you need without the knee pressure. But you want to apply this pressure for approximately 30 to 45 seconds in this position, reinforcing the upright spine and sitting the hip into the ground. And after that's done, prop yourself back and then go to the next point that you can find. Clear out everything that you can find along that hip and then retest. The old scientific method. So first go to the opposite side, the one that maybe was perceived to be a little bit easier. And again, take a mental snapshot of this position, how it feels in terms of the effort, ease in getting into position, and go back to the same side that you just treated. And you should find that they level out and become more or less even in terms of effort and intensity. However, I find that most people, especially power lifters, tend to end up having problems in both hips. You don't necessarily need to have both of your cheeks on the ground for this one. It's just a metric to aim for. However, what you want to check is symmetry. It should be just as easy on one side as it is the other, but always follow the test, intervene, retest strategy.